Over the last 25 years or so, my colleagues and I have been looking at different ways to help teachers develop their practice of formative assessment. We've looked at feedback, we've looked at collaborative learning and peer assessment, we've looked at sharing learning intentions and success criteria, we've looked at self-assessment and metacognition. But one of the things that we think has the greatest power to improve what happens in classrooms is to help teachers elicit better evidence about what's happening in the heads of their students. And of course the best teachers have always done this. The best teachers always try to find out what students are learning in the middle of the lesson. Madeline Hunter in the 1970s talked about the importance of frequent checks for understanding. But too often, those checks for understanding take the form of a teacher asking a question to a class, maybe half a dozen students raising their hands, the teacher getting one of those students to respond, and then if that student gives a correct response, the teacher says, okay, and moves on. And what our work has convinced us of is that that's a very poor basis for teachers' decision making. If you're only hearing from the confident, articulate students, then you cannot possibly make decisions that reflect the learning needs of all the students in that class. So we have to get information from all the students rather than just the usual suspects. Some teachers do this with mini whiteboards, but the difficulty with mini whiteboards is if students write different things, then it takes you a long time to make sense of all the different responses. If there's more than 5 words per student, you've given yourselves over 150 words to read, which is a very challenging task. And that's why I'm so convinced about the power of diagnostic questions. Questions that a teacher can ask in the middle of a lesson, get a response from every single student in a couple of minutes, and then eyeball all the students' responses and make sense of it quickly in 30 seconds or less. And that's why it's really important that diagnostic questions are multiple choice. Now, some people think that multiple choice questions are problematic because they seem to advantage boys over girls, but that's mostly because diagnostic questions that are in multiple choice format don't require lots of language. So boys can often do well even if they don't know how to express themselves linguistically. But more importantly, a quick multiple choice question with 4 or 5 options helps the teacher quickly make sense of what's going on. Rather than having 30 idiosyncratic responses on mini whiteboards, you have just 4 or 5 possibilities and you can quickly eyeball who's getting it, who's not, what shall I do? Do enough of them get it that I move on, or should I stop, or should I pair them up? And that's the power of multiple choice questions. In fact, I would go so far as to say that I think multiple choice questions should hardly ever be used for summative assessment. They should be used far more for formative assessment because it enables a teacher to get a quick read on a class and decide what to do next. That's why diagnostic questions are, in my view, one of the most important developments in educational technology over the last 20 years.